you stressed out?
Yes.
That's good. It's actually a very good, we brought Robin here especially because she's here to help out. Are you stressed out? It's very interesting. If you ask people that question, what is going to be your answer? I mean, everybody's like, yes, they're going to hang, you're going to hang up, you know, they're going to put their hands up, their feet up. Everybody's stressed out. It's kind of like, this is an American dysfunction, if you will. This is an adrenal fatigue seminar, and we're going to talk about the adrenals. Now, when you think about adrenals, like, what are the adrenals? What do they do? What's the deal with it? Well, that's what we're really going to talk about here. Adrenal imbalances are probably the most common health problems we see in functional medicine. What that means is there's a lot of chronic degenerative diseases out there. Everything from heart disease, cancer, diabetes, strokes. There's a lot of things that are chronic degenerative diseases. And it's really not enough just to name those diseases. We need to find out what's driving or what's causing those problems. And long-term adrenal imbalances is really a major factor in causing a lot of problems in people's health. Now, it doesn't have to be cancer or heart disease. It could be just, I don't feel well, I don't sleep good, I'm having uncontrollable hot flashes, or all kinds of different things are happening. And adrenal fatigue or adrenal stress can really be at the root of the problem. So that's where we're going to start off here. Adrenal stress can run the gamut from too wired to too tired. Some people are too wired and some people are too tired. Fatigue, headaches with mental or physical stress. You know, every time I get every time I get up, I have to concentrate too much, I get a headache. That's a good sign. That might be a sign you're having an adrenal problem. Weak immune system. These are the folks that, well, doc, it's okay because I get bronchitis once a year. But that's not normal. You shouldn't be having that. But you know, some people come to a level of acceptance with that, or you'll have frequent colds or allergies or this kind of thing. Slow to start in the morning, and I'm going to explain why this happens. In other words, you go to sleep, and even if you sleep 7, 8, 9 hours, you wake up, and it still takes you 2 to 3 hours to feel like, oh my goodness, I'm finally getting moved. And then later in the day, you're like, I'm feeling pretty good. About 6 o'clock, feeling pretty good. About 9 o'clock, 10 o'clock, you start kind of getting a little bit tired. And then if you don't go to sleep right then, by 11 o'clock, you're like, whoa, yay, I got another juice of energy. That's a sign of an adrenal problem. Dizziness, when you stand up, not enough blood goes up to the brain, you get a lower blood pressure called orthostatic hypertension, hypotension. Brain fog. Now we know what that is. That's when you're just, I just can't remember. What was that? Or you walk into a room and you're like, why am I here? You know, so brain fog is that thing that things just aren't clicking right. This can be a sign that you have adrenal stress. Decreased libido, and I'm going to show you how that works as far as how that's related to the adrenal function. Irritability, hard to get to sleep, hard to stay asleep. Difficulty in coping with stress, depression. These are just some of them. Almost nearly every symptom that you can name, you could probably 1 or 2 spaces removed from the adrenals, you could see where it could come from. And this is really why I want to talk about adrenal fatigue, because this is a major driver of health problems. In our work that we do, our main purpose is to find out what's causing the problem, not just simply, oh, somebody's having a headache, let's do this, get rid of the headaches. Oh, somebody's having a stomach ache, let's do this, get rid of the stomach ache. We always want to look behind the curtain to see what's driving the problem. Does that make sense? Because if you correct the cause of the problem, then your body can be healthy and well, and you can age well. That sounds good, doesn't it? And it's exactly right. This is what the adrenals look like. They used to think that the adrenals were part of the kidneys and actually did kidney functions. So they called these the renals. That's the kidneys, the renals. And they call these the adrenals. AD means above, so you got the adrenals. There you go. So now we found out it really doesn't have that relationship. I want to go through a few things. When you see a slide like this, by the way, how would you like to look like that? But anyway, that's another thing. I was just noticing that. When you see a slide like this, when we do this presentation, when you see this, don't let the brain fog kick in. Just because we're going to walk through this piece by piece, and it really will be easy to see. The adrenals are going to release a number of substances for different things. What do the adrenals do? The adrenals are basically your gland that helps you cope with stress. whether it's mental or physical, or whether it's physiological. And you'd be very amazed that the biggest stresses on our bodies are a lot of times physiological stress. Yeah, I know we get stressed out, and oh my goodness, I'm in a bad relationship, or I've got this going on, I've got that going on. That definitely can create stress, and that stress can lead to adrenal fatigue. There's no question about it. But your adrenals, they're always mounting a defense against the stress, so you can adapt to the environment. Isn't it awesome the way the body works? We're made to adapt to the environment. So, but if you push that button, if you push the lever too much and make those adrenals work too hard, over a period of time you don't shut them off, they start getting tired. When they start getting tired, guess what happens to your ability to cope with stress? It goes down. Now, your ability to cope with stress is not just simply like, I'm dealing pretty well with this adverse situation, although that can be a part of it. It can be things like you're not adapting to regulating your blood sugar normally. You're not adapting to, you're developing food sensitivities. All these other things that go on that we're going to talk about. Aldosterone is something that's secreted from the adrenals. The aldosterone, basically, what it does is keeps the right amount of water in your blood. It'll cause you, if you don't have enough water in your blood, it will take some sodium from the kidneys so that they don't excrete it out, and that way you retain the water like you need. Cortisol, this is the big one. This is the big one. Probably everybody's heard of this. Cortisol, mainly what it does is it increases the blood sugar, it blunts the immune system reaction, and it allows for a longer term process of coping with stress. And I'm going to explain this a little more in depth. DHEA, who's heard of that? Okay, that's a precursor to like your testosterone, your estrogen, and so on and so forth. It also has to do with your mood, how well you feel about yourself. Also has to do with bone health, muscle health. We'll go through this: testosterone, estrogen, epinephrine, norepinephrine. When you see epinephrine, norepinephrine, just think adrenaline and noradrenaline, because they're interchangeable, but we have a tendency to think of adrenaline. We know what adrenaline is, right? Oh my goodness, I feel that rush. That's the adrenaline right there. So, okay, normal stress response. Now, like I said, don't look at this and say, oh my goodness, I'll never figure this out. Don't worry about this. We're just going to walk through this. I want to go through the mechanism of how the adrenals are actually working, because if we understand how the adrenals work, then we can understand what to do about them if we're having a problem. First thing, the hypothalamus, which is located in the brain, receives information from the brainstem saying there's a stress reaction going on. That can be internal or external, and guess what? It makes no difference to the hypothalamus whether that stress comes from the outside environment or the internal environment. I'll give you an example. If you're getting all stressed out about something and you just can't, whatever, you can't get, well, this is going to cause the same reaction if you've got this really crazy blood sugar problem going on. Because both of them are going to be stresses on the body. Does that make sense? So either one of them is going to trip this switch. And then the hypothalamus, when it sees this norepinephrine, which is, remember, it's noradrenaline, when it sees the adrenaline coming in there, then the hypothalamus is going to release something called corticotropin releasing factor. Now, what is that? That's a hormone that goes to the pituitary gland, and then the pituitary gland is going to send down some ACTH, which is adrenal corticotropic hormone. It's not important to know those names, it's just important to understand the mechanism. So ACHT, that guy right there, ACTH, I said it backwards. Once it hits the adrenal cortex, the adrenal medulla, the adrenals start putting out these different substances. Now watch this. This is a point to make this easier to grasp. I believe it helps me. Epinephrine and norepinephrine, it is the short-term response. I came up behind you, Stephanie, and went boo, and you went woo, whatever you did. You probably didn't do that, but that is that immediate adrenaline rush that you feel. You're standing over. I don't think you were there, Robert. We were with the youth group back in early 2000s. We went to Arizona and went out there. It was a really awesome time, and so on and so forth. Went to the integrated reservation, had a great time out there. But anyway, we looked out over the Grand Canyon. That was an adrenaline rush. That's what I'm trying to explain. I looked at it as a woo. That's that thing that you feel. So this is this side of that reaction, okay? The other side of the direction that you don't necessarily feel is the dumping out of the cortisol and DHEA. Cortisol is important at this time because when you are under stress, whether it's external or internally driven, when you're under stress, your blood sugar needs to raise up a little bit. Anybody know why? Because you need the extra energy. Does that make sense? See, isn't it cool how the body works all these things around? That's exactly right. So cortisol is not the enemy. It's not good or bad in itself. It just has to be in the proper balance. If you get too much of it, it's a problem. If you get too little of it, it's a problem. So, okay, so that's the normal stress response. Now, something really, really cool happens here. I just love the way the body works, the way it's designed. There's something called a negative feedback loop. What that means is this. The cortisol and DHEA, when it's released from the adrenal glands, it'll float around in the bloodstream. When it comes up to the locus coeruleus, or this guy right here, the brainstem, and it goes to the hypothalamus and it goes to the pituitary, each one of these have receptors on them. Like they have cells, and they got little receptors out there. When it sees a cortisol, it grabs a hold of it, and that tells it to quit the cycle. So it has its own built-in shut-off valve, if you will. Isn't that cool? So in other words, that keeps you from just, I don't know, I had a Ford Pinto when it's like my first car, and if you got the gas down too heavy, it would stick. So that's not good, by the way. But the gas doesn't stick here because what happens is the cortisol floats around and then it trips that off and it turns that mechanism off. It's called a negative feedback loop. Does that make sense? It's really important to get that concept. So in other words, the body's not going to just allow this to happen over and over and over without, because you can imagine if we just keep on tripping this, what's going to happen with that. Okay, let's move on. I just found a picture, clip art, somebody saying 3, and I thought I'd put that up there. We are going to address 3 mechanisms leading to adrenal fatigue. Now, here's where we're going to start, where the rubber starts meeting the road. General causes of adrenal fatigue. There are, and this is the very first thing we want to discuss. By the way, and I'm seeing people write notes, that's great, I think it's awesome to do this. I am going to put these PowerPoints on a PDF, and if you would like to have that, all you have to do is let them know at the front, and I will email them to you, and you can read all of this. And so don't feel like, oh my goodness, I didn't get that last thing written down. You will have access to this. Okay, food sensitivities. This is the #1 cause of adrenal fatigue. Now, when I say it's the #1 cause, I'm not saying it's the only cause. I'm saying it's the most common cause. Many people are running around today with food sensitivities without even knowing it because they don't have that. They eat something, they get the sinuses, they get this, they get that. They may not feel any symptoms. As a matter of fact, if you have a food sensitivity that you're unaware of, if you're unaware of it and you violate that, we call that a food sensitivity violation. If you violate that over and over and over, you will blunt the reaction so much that you don't even feel that headache, shoulder pain, fatigue, or whatever may be associated with that. I'll give you an example of this. Many people who are smokers over a period of time become sensitive to cigarette smoke even though they still smoke. Now they can smoke and they don't feel that reaction even though it's creating crazy amounts of inflammation in the blood, but they're not getting this reaction of feeling bad because the body's blunting that reaction. Does that make sense? Because you couldn't live with that. Very interesting, after they quit, what do most smokers, ex-smokers say? I cannot stand to be around cigarette smoke. And the reason why is because they really are sensitive. It's not just that it's an offensive smell or whatever. And by the way, if you're a smoker, I'm not really trying to get on you unless it would help you, then I will. But anyway, that's another story. But just for instance, for this, what we're talking about here is a lot of times after somebody's been a smoker for 5, 10, 15, 20, 30 years, they quit. And then when they get around smoke, they really have adverse reactions to it that are just don't feel very well with it. And the reason why is because they have sensitivities, and since they've been away from it long enough, their body's clean from it, and they see a little bit of it, and boy, you get a real reaction there. So, okay, chronic infections, viruses, bacteria, fungi, and parasites. I have to tell you, this is a big one. This is a big one. And out of all of these, I don't like to make a statement like this because there can be variables in what I'm saying here. But out of all of these, this is really the toughest one to deal with. It can be. It can be. Sometimes you can take care of the infections pretty easy, but when you've got a parasite in there, or you've got a cell wall deficient bacteria to deal with, which are like your Lyme's disease, your sarcoidosis, things like that. You've got viruses. This is Epstein-Barr viruses, this cytomegalovirus. These different things. You can just harbor these things chronically, or you can have gut infections. You can have infections going on in the gut, and I'm scaring everybody to death here, but we'll make this better in a minute. I just want you to understand that this is really a hard one to deal with. You can deal with it, but the first thing we really have to do is identify that this is the problem. Somebody has anemia. If you don't have enough oxygen going through your blood, this creates a stress on the adrenals, because what's happening is, anytime you don't have enough oxygen floating around, it's a physiological stress, and it's going to cause, let me just back up a second, it's going to cause this mechanism to continue going because it's trying to fight that stress. Does that make sense? Okay, blood sugar surges, this is a big one too. This is a big one too. As a matter of fact, when I see somebody that has adrenal fatigue, and I know, or adrenal stress, and I know that that's going on, one of the first things I'm thinking about is we've got to find out, we've got to identify food sensitivities first, and number two, we've got to make sure the blood sugar's stable, and number three, we'll talk about a little bit, we need to make sure the liver's detoxified and we're cleaned out, and that we have good digestive health. So here's the next thing, dehydration. Simply not drinking enough water. Not drinking enough water. How many, I mean, I'm not asking for hands, but a lot of people do not drink enough water. Now, I'm not on the page of drinking 8 to 10 glasses of water a day. I'm really not. I don't think we need that much. But I do think that we need more than just a glass or two, especially if you're drinking tea or caffeinated beverages or other things that are, that can rob your body of the water. Heavy metal burden. Today, we have 400 times more lead that shows up on autopsy in our bones than we did 100 years ago. So in other words, when they did autopsies 100 years ago and they measured the lead in the bones on average, we have today 400 times more than we had then. Why is that? I mean, look, it's the industrial. It's what we have. I mean, it's what I'm not here to complain about it, and I'm not going to tear anybody's trees down. I'm just saying that this is. We have to deal with this. We have to understand that that's a problem, and we have to do the things that we can do to make sure we're naturally chelating ourselves, and there are ways to do that, and I'm going to show you that in a little bit. Environmental toxins that goes along with it. In environmental toxins, I'll also put BPA in that. That's from the plastics. Some of your water bottles, your different things that you can get plastic from. If you get a plastic container that is not BPA free, do not put hot coffee in it. And don't put other hot beverages in it, because they find out that the hot liquids mobilize that BPA, and you're drinking the BPA, and that causes problems on the receptors, not only for adrenals but thyroid and everything else. Traumatic events. This is bad. Somebody has a major traumatic event. They go through a divorce. They go through a death in the family. These can be life issues with death and different things like that. But when people have traumatic events, it's really important that we. I lost my father about 6 months ago. Back in October, it's been 7 or 8 months ago, and it's tough. I mean, it just is what it is, but it's tough. And when you have that loss, you have to walk through the process in a way that you can be healed through the process. Now, you can't be restored and whole because you're in a different situation, but we have to walk through these processes in a way so that they are not affecting our physiology. Now, that's not the only reason, obviously, but for adrenal health, for good adrenal health, we have to take these situations and do what we need to do to allow ourselves to be healed through that process. It's very important. I think this is very overlooked, because I think there's a lot of people hurting and suffering out there with illnesses that they didn't really realize that 7 years ago this happened, but they, for whatever reason, just weren't able to work through that. So anyway, electromagnetic radiation. These are our cell phones. These are our little clickers. These are everything we have. So some people are bothered with that more than others. I'll even recommend with some people that have a really bad adrenal fatigue to turn off all electronics in their bedroom when they go to bed at night, so that they can sleep free of the electromagnetic stuff that's going on. And by the way, let me just say this. Sleep is very important for your adrenal fatigue, if you're not sleeping, you have to sleep. I mean, some people say, hey, I only need 4 or 5 hours of sleep. That's not really true. Now, you might be able to just deal with that, but it's not good for adrenal health. And here's what, I mean, I advocate having the room as dark as possible. Get you something over your eyes, do whatever, because the darker the room, the better you'll be able to sleep, because the darker the room, this goes into another topic, but let me just say it real quickly. The darker the room signals to the hypothalamus to release the melatonin, and helps that whole cycle happen right, and you can sleep deeper, sleep better. When you do that, you have better adrenal health. Protein malnutrition. You know, protein malnutrition, just not, a lot of that can happen, just not have enough acid in the stomach. If you don't have enough acid in the stomach, your body can't break down the proteins properly. How many people today, and I'm not asking for hands here, but how many people today are actually taking an over-the-counter or a prescription proton pump inhibitor for acid reflux, GERD, or whatever the name may be that you've been given? There's a lot of folks out there, isn't there? There's a lot of folks doing that. And did you know, and we've talked, if you've been to any of those talks, you know we always talk about this, but when people have heartburn, it's not because they have too much acid, it really isn't. It's because they have too little acid, and the food is not being digested properly. So what's happening is the small intestine is actually rejecting it, and so the food's rushing back up this way because the small intestine is rejecting it. So the stomach's okay with 1.5 pH acid, but the esophagus is not okay at all with that much. So even if you have too little acid, even a little bit that goes up there makes you feel heartburn. So what do? We clobber the stomach with something that's going to make no acid. But if you don't have acid, you don't absorb calcium, you can't break down calcium, you can't break down protein, you get protein malnutrition. So if you don't get enough protein going in, then you're going to create a situation where you have adrenal fatigue, because this causes stress. Poor sleep patterns, talk about that. Methylxanthine, this is the caffeine chocolates, that kind of stuff. And that's the darndest thing, because a lot of times when people have adrenal fatigue, guess what they want? But there's a way we can break that cycle. There really is. It can happen. Alcohol, leaky gut, toxic relationships. I like the way they said toxic relationships. We got all these environmental toxins. Listen, now we got toxic relationships. So anyway, we make everything toxins. So anyway, toxic relationships, and I think we can, well, that is. Trans fats, medications. Did you know that medications will most definitely cause you to have adrenal fatigue? Absolutely, causes stress on the body. Drugs are great for when they need to be used, but they're lousy if you're trying to maintain good health. And I'll give you an example of that. Somebody has high blood pressure and they take high blood pressure pills. Now, I'm not here telling you not to take your high blood pressure pills, but I want to get this point across because this is very important. If you're taking high blood pressure pills because you have high blood pressure, I would suggest that what you need to do is find out why you have high blood pressure and correct that. If you're taking proton pump inhibitors because you have acid reflux, then my suggestion would be to find out what's causing your acid reflux, and I'll give you a clue right now. Would you like to know what causes acid reflux? Most of the time, I would not say 100%, but almost always, it is a food sensitivity. Almost always, even if you don't feel like you have food sensitivity, it usually is. If somebody's having, by the way, did you see the thing that just came out on Fosamax? People's legs spontaneously breaking and this and that, and I see that now there's class action suits going on. Well, I mean, of course, this is what happens when you think that you have a great idea about making the body work a certain way, instead of going back to the principles. And this is what I really, if you don't get anything else out of this, is what I want you to get, is that we have to find out what's driving and what's causing the problem, so that we can address it properly, as opposed to saying, oh my goodness, my bones are weak, I need to take Fosamax. Oh my goodness, I have heartburn, I need to do this. Oh my goodness, I have migraines, I need to take this drug. Oh, I have, I can't sleep good, so I need to take that nice little butterfly thing, the Lunesta or whatever. You know, we get into this mode of doing this, and it really wreaks havoc on our health. It causes problems with our adrenals, but not only this, we have not fundamentally solved what is causing the problem. Does that make sense? Because if you don't solve the problem, I know this is like we learned this in kindergarten, but if you don't solve the problem, you're going to keep on having the problem. It may look different. You may dress it up. You may put a little whitewash on it, but it's still a problem. So there you go. All right, I won't preach anymore. Medications, essential fatty acid deficiency. Sometimes people, there's omega-3s and there are omega-6s. Omega-6 fats are not your vegetable oils and a lot of the other things. They're loaded with omega-6. There's a lot of other things. But omega-3s and omega-6 always competes. Omega-3s primarily come from fish and that kind of thing. So if you eat a lot of foods that have these omega-6s in, it knocks your omega-3s out. And you have to have the omega-3s. These are essentials. Okay, very good. Let's get to the ones with the pictures. These are the more fun slides, aren't they? Okay, now we're going to go through and talk about, do you have adrenal stress? Everybody by this time is saying, oh my gosh, yes. But anyway, let's walk through the let's walk through the process. Are you okay over there, Kimberly? Let's walk through the process. Here's what we do. You walk into the office and we say, okay, we're going to see if you have adrenal stress. We're going to look at a pupillary reflex. I'm going to show you what that means. We're going to look at your tongue, see if it's rough sandpaper. We're going to ask you if you get dizzy, you stand up. We're also going to have you take. We're going to take your blood pressure sitting down. We're going to take it standing up. We're going to see what happens. Low blood pressure non-athlete. We're going to ask you if you have low blood pressure. We're going to take your blood pressure. Do you feel bloated after a small meal? I feel, I ate a small meal, but I feel bloated. Why is that? Because the adrenals, they not only do all the other things we talked about, but they also promote the stomach to make the hydrochloric acid. So if your adrenals become fatigued, your stomach doesn't get its full complement of hydrochloric acid. So if you don't have hydrochloric acid, guess what happens? Well, we already talked about this. You don't break down the protein, you don't break down the calcium, you don't get good digestion, it goes north, then you start taking the little purple pill and all that other stuff. Okay, brittle fingernails and cortisol, rhythm, and balance. Let's talk about these. Oh, good. We got to the pictures. This is a pupillary, and I picked this one because you see that that's the pupil, and you see how this one's bigger? Very interesting. We'll do this. Kimberly helps us do this. We'll shine a light straight in your eye, and when you shine a light straight in the eye, that pupil should constrict down and should be able to hold for 15 to 20 seconds. But here's what we see when somebody has adrenal stress, all the way from adrenal stress to adrenal exhaustion, the whole gamut. When your pupil, when we shine a light and the pupil goes down, and then here's what it'll do: it'll go down, and it'll bounce back up, or it'll flutter, do a bunch of different things. This is the neat trick to try at home. Get a flashlight. Get your husband out and said, I told you you need to go see Dr. Kessinger here. I'm shining in your eyes. So I'm just kidding with that. But you shine a light in the eyes and you'll be able to see it. You'll be able to see it. There's no question about it. Systolic blood pressure should increase 10% upon rising. In other words, when you sit down and then you stand up, your blood pressure should rise. Does anybody want to venture a guess why? It's because you need blood in your brain. See, so you get, boom, you get blood pressure, your pressure increases, so you get more blood into your brain. This is the reason why when somebody has adrenal problems, they'll sit up, and guess what? Yeah, I'm just feeling a little dizzy. See? Yeah. Or they're laying down, they get up and say, I'm just feeling a little, it takes them a little, just takes me a little while to get myself, right again. This is most likely an adrenal stress that's going on. So that's the reason why in this office we'll take your blood pressure sitting down and then we'll take it standing up. And if your blood pressure is the same or lower, then this gives us an indication that you're not mounting a proper adaptation to the stress of standing up. Does that make sense? And that means your adrenals are not functioning properly. Are you guys getting this? Are you learning something? Good. That yucky, bloated feeling. And by the way, if anybody has a question, I actually looked the word yucky up. That is how you spell it, in case you didn't know. That's not how I first spelled it, but I was like, that can't be right. So I had to Google it up, because I said, I'm not going to put this in here. But anyway, that yucky, bloated feeling. The adrenals stimulate the stomach to produce HCl, which is essential for breaking down foods for digestion. So low HCl causes bloating. Did you know that? If you feel that, even if not small meals, but you feel bloating, don't raise your hand, but if you feel bloated, this is an indication that you don't have enough hydrochloric acid, and there's things we can do about that, and we'll talk about it. Brittle fingernails. This is a normal nail, should look nice and shiny and so on and so forth. But we see the cracks in here, or fingernails that just aren't very strong. Now, adrenals are not the only issue that will cause that, but it is a common reason for that. You see this right here, a little bit of ridging here, but it's just kind of split at the end right there. That's another example. You see the ridges coming through here? There's a lot you can tell from the fingernails and the toenails. When people come in, I like to look at the fingernails, I like to look at the toenails. It shows me not only circulation, but it shows me hormonal health, it shows me adrenal health, it shows me thyroid health. There's so much you can get from fingernails. There's another one right there. You can tell I'm excited about fingernails. I put 4 pictures of fingernails up here. Okay, I just want to give some examples. You all see that? Yeah. Now, if you've got those things that you went down to where my wife goes and she likes to get toes done and so on and so forth, and she doesn't do the fingernails, but if you have fake fingernails on, that doesn't count for diagnostic purposes. So. Okay, good. Cortisol rhythm. This is, now we're getting down to it here. Cortisol rhythm. This is how your cortisol should flow in your body normally. At about 12 o'clock midnight, it starts heading down to about, I'm sorry, did you hear just what I said? Let me back up because I stated that incorrectly. Let's start here. Right here, this is midnight. 12 o'clock midnight. Your cortisol level should be just right about at its lowest point, okay? And then upwards about 6 a.m., right here, 8 a.m., it hits its peak, and then throughout the day it goes down like this until we get down to the 12 a.m. Where's 12? That's then we go back through the cycle again. Does that make sense? So I'm making a big deal out of this because this is a major, major, major deal. Because you remember, what does the adrenals release? What does it make? The adrenals will make. There's a restroom in the back if you want to go over that way. Yeah. The adrenals will actually make cortisol, DHEA. Remember, that's the long-term response to stress. But what was the short-term response to stress? Epinephrine and norepinephrine, which we call adrenaline and noradrenaline. These are the 2 things. By the way, let me back up just real quick and say that this cortisol rhythm, we get so much information from this. This is really the best way for us to know about your adrenal health. I'm going to get back to that, but I want to talk about cortisol for just a moment. I want to talk about cortisol and DHEA. Remember, that's the long-term adaptation to the stress. Cortisol 5 is produced in the adrenal cortex. It's on the outside portion of the adrenals, not the inside. It's anti-inflammatory. Now, think about this. Cortisol, cortisone, steroid, prednisone. So why do people take prednisone? It's to calm down the immune system, right? Because prednisone is anti-inflammatory. Now, I'm not here, advocating for prednisone, obviously, but I'm just getting the point across that cortisol is an anti-inflammatory. So if you have not enough cortisol, what are you going to have? Inflammation. You're going to have inflammation. People with long-term adrenal fatigue, they come in the office and say, "Doc, man, I just hurt across my back, my neck hurts, and that felt really good when you did that last week. Let's do it again." The reason why is because that short-term stimulation of what I did didn't really correct the problem all the way, because they have to work through the process of building the adrenal health. But it felt like, oh, do that again because that felt good. Because guess what? They have a lot of inflammation if they have low cortisol. It supports or suppresses immune function. Remember, if you see these things, these ads on internet, TV, whatever, and say, this is an immune booster. Well, it may be a good thing for that person, but you don't really need your immune system boosted. You need your immune system balanced. It's all about balancing the immune system. You don't want too much, you don't want too little. Cortisol levels have to be in that sweet spot in order for you to have a nice balanced immune reaction. Increased blood sugar. This is what cortisol does. When you get a dumpage of cortisol in the blood, it raises blood sugar. Why is that? Because you need the extra energy. Absolutely. It's required for the healthy intestinal barrier. Now, if you were at our food sensitivity talk we did a few months ago, and if you were at a thyroid talk we did last month, you know how important this is. Your intestinal barrier is a major gate that separates you from the environment. So you eat the food and all the stuff that comes in, you have a gate down here that keeps all the bad stuff out. But if that gate starts getting weak, things start going in that's not supposed to go in, and it sets up an immune reaction, autoimmune reaction. We can have everything from scleroderma to rheumatoid arthritis to psoriasis, or just simply not feeling good and having an autoimmune unnamed condition. It can shut down digestion by reducing blood flow. So if you get a lot of cortisol in your system, it's a long-term adaptation to the stress, right? So if you're under stress, do you need blood in your digestive system, or do you need blood in your muscles? You need blood in your muscles because you might need to run away from something. A bear might be chasing you, see? So you need blood in your muscles. You don't need it in this. Somebody's over here saying I need it in my digestion. But it robs the blood from the digestion, so it slows that down. By the way, this is all normal if it's happened in its right ratios. Breaks down tissue from stress, gut lining. So if you have long-term this cortisol just bouncing in, it really tears intestines up. A lot of things. DHEA facts. Okay, so these are the two things: the DHEA and cortisol. It's produced in the adrenal cortex. It supports immune function. It supports liver health. The detoxification pathways. The body has to be able to detox. If it's not detoxing, things don't work well. Give you an example of this. I mean, you can go so many circles around this, but this is just one point. Give an example. Somebody can have too high of estrogen in their body. When they have too high of estrogen, it can relate to things like polycystic ovarian syndrome, a lot of different conditions that can happen, PMS, just different things like that. But if your DHEA is too low, then this will affect the liver's ability to actually detoxify the body. One of the things that the liver detoxifies is estrogen as it's running through the system. Estrogen is fat soluble, so when it comes to the liver converts it, makes it water soluble so your body can excrete it. Now, if your liver's not working well, it's not going to be able to excrete it as well, so guess what you have more of? Estrogen. Now, this is the reason why, I'm going to make this point again, this is the reason why I do not recommend right off doing female or male hormone testing. I don't recommend doing that. You say, oh my goodness, that's blasphemy. Everybody that's in natural healthcare wants to do natural hormone testing. I do not. Because you have to resolve these issues first. Because if you resolve these issues, 9 times out of 10, the hormones will balance out and they'll take care of themselves. Does that make sense? Because you probably have an issue that's going on that's driving your estrogen up, driving your testosterone down, or whatever the situation may be. Builds bone, stabilizes mood, detoxification. Okay, precursor to sex hormones, testosterone, and estrogen. So we need DHEA to make testosterone, estrogen. Let me say this at this point, because I know people do this. They'll say, "Oh wow, that's DHEA. I need that because I have low testosterone. I need DHEA, or I need more of the sex hormone. I need the progesterone, whatever. So I'm going to supplement myself with DHEA, and I'm going to say I don't recommend men taking over, and you can write this down, men taking over 5 milligrams of DHEA a day, and I don't recommend women taking over 10 milligrams. And even in this, I'm going to say, don't take it unless you've been somewhere where somebody knows what they're doing, has actually prescribed it to you. Because what happens is if you put the DHEA in there, it can cause a lot of things to foul up if you don't do it properly. And I mention this because I know some products are out there, I'm not bashing anybody, but I'm just trying to teach this, that have 20, 30, and 50 milligrams of DHEA, just one pill. So this is too much. By the way, if you have a DHEA problem, you know what I'm getting ready to say. You got to find out why you have it, fix that. Don't just start putting stuff in there. Okay, got it? Okay, Wayne, we got back to the pictures. All right, now, here, I don't know how this is going for you. I want to make sure that we're bringing this out in such a way where we're piecing it together. I'm getting ready to take just a little bit of a left-hand turn, but I want to really catch this. This is really important. Don't look at this yet. Remember, the long-term adaptation for adrenals is what? Cortisol and DHEA, right? So your cortisol and DHEA have to come out in specific ratios. Okay. Now, let me back up and say this. Cholesterol is the precursor. In other words, that's the fundamental building block of something called pregnenolone. Pregnenolone stands for pregnant, which means it can make a lot of stuff. I guess that's what that means. So anyway, cholesterol is the basic building block for pregnenolone. Now there's only so much pregnenolone in the body. You only have a finite amount. So what happens is that pregnenolone, pending the situation, is going to produce DHEA, or it's going to produce progesterone, where you get your cortisol and aldosterone. Does that make sense? Okay, so now let's just back up this second. And can you imagine what happens if you force your cholesterol levels down? You force your cholesterol levels down, what are you doing to your body's ability to make pregnenolone? And if you're not, it's exactly right. The sickest people are people with low cholesterol, not high cholesterol. By the way, let me say it again. We do a heart disease talk called Younger Arteries. We're going to be probably doing it a few months ago. And we discuss in there the cholesterol. If you have high cholesterol, you know what I'm already going to say. You got to find out why you have high cholesterol and fix that problem, as opposed to just trying to dump something in there to force it down. It's really the height of ignorance to just drive it down with the drug. Now, I know that sounds caustic, but let me explain what I'm saying. Ignorance means not knowing, because I'm sure they're not doing that maliciously, but I'm telling you, it's tearing up a lot of people's health. You cannot drive down artificially cholesterol without having ramifications. You cannot do it. I don't care if your cholesterol is 300. You can't just drive it down. You have to find out why it's there and correct the problems. Most usually it's oxidation, it's inflammation that's coming from somewhere. Could be infection, could be something else. You just have to take care of it. And then deal with that situation so that the body can react normally. Okay, let me get off my soapbox, then back onto the talk. Cholesterol in normal healthy levels will produce this. Now, if you get under a lot of stress, internal or externally driven, what we've been talking about, there's going to be something called the pregnenolone steal. The pregnenolone steal goes like this. The body is going to sense that it needs to fight this thing, so guess what it's going to do? It's going to drive this pathway this way so much that it's going to cut this pathway off. And if you cut this pathway off, this is the guy that has the testosterone levels of 200, 250, 300. I don't feel as good as I used to. I have low libido. I don't have really desire for life. I just don't feel good. I'm 48 years old. I'm 55 years old. I don't know what happened to me. Well, the person probably, maybe he's working too hard. Maybe he's got some of the other issues we've talked about here going on, and he's got a pregnenolone steal going on, and his body's simply not making the testosterone. Does this make sense? So here again, let me reemphasize this and say that that's the reason why we don't just jump into doing the sex hormone or the female-male hormone studies. And yeah, sometimes you do need that, but here again, fix the problems, and a lot of times these things will go away. Okay, very good. All right, pregnenolone steal causes people to have fatigue, weight gain, low libido, low thyroid, decreased gut function, mood swings. So how many people are out there have that? You know what I mean? There's a lot of people out there dealing with these problems without really realizing that. Now, here's what happens. People take fatigue. Oh, let me take something for that. Now, they don't get a prescription usually, but they'll do caffeine or they'll do this, kind of, pump themselves up. Oh, I've got weight gain. Okay, oh my goodness, that's a $1 billion industry. That's a big industry. Low libido. You see the commercials on prime time that you shouldn't see that they have about that. Low thyroid. I didn't say this before, but and I really should have. I'm a little reticent to do this, but let me just say this: hypothyroid and adrenal dysfunction are cousins. You almost can't have one without the other. If you have low thyroid, you're going to have a low adrenal. If you have low adrenal, you're going to have a low thyroid. When you have low thyroid, you don't have enough energy for your body to work like it's supposed to. There's all kinds of things we discussed it last time. If you'd like to get that, we can get that DVD for you. But there's so many things that are wrapped up between these two. But again, let me back up and say, what am I going to really say? You have to find out why you're having the problem, not that you just have the problem. It's obvious. It doesn't take a lot to figure out you have that problem. What it takes is figure out is what's causing the problem. What can I do about it? Okay, let's move forward. Cortisol and DHEA ratios affect various body functions, and I'm going to rush through this right here. Like I said, we're going to give you the PDFs if you want that. Musculoskeletal health. Your bones have to turn over to be healthy. And I don't mean you're standing there and you just flip upside down. What I mean is new tissue cells have to replace old tissue cells, and you go through this cycle. Neural health, this is memory and learning. You know what happens? Sometimes people say, I just have a hard time picking things up like I used to. Or where did I put my keys? Or these are signs that the cortisol DHA ratios are out of whack. Endocrine function. Here again, you have adrenals. When adrenals are out, because the adrenals touch the hypothalamus and touch the pituitary, they touch all of the hormonal system. That's the reason why we say fix the adrenals, make sure the thyroid's working right, and a lot of these issues will resolve themselves. Fat and protein metabolism, detoxification pathways, eicosanoid modulation. This is inflammation. Guess what happens when your cortisol DHEA ratios get out of whack? Doc, I just have pain all the time. There's no reason for it. I didn't sprain. I didn't, I didn't fall. Anything like that. Sugar metabolism. Adrenal stress affects the whole endocrine system. Because it touches all the different things. The immune system. That's the thymus. There's the thyroid gland. There's the pancreas. Makes the insulin. That's the reason why blood sugar levels are so important when we're dealing with this. Okay, here's a test that we run to check somebody's cortisol or adrenal health. It's called an adrenal salivary index. This is the one that you want to do to make sure you're looking right. Now, I would tell you before you get started, you don't just run one of these. You run the first one unless it's normal. You run the first one to establish a baseline, because in 12 weeks, 16 weeks, 18 weeks, 8 weeks, depends on what we find on that, we'll run another one to make sure we're making the progress we need to make. That's how that works. You should have, remember what I was showing you, the cortisol levels are high in the morning and then they go down through the day, right? So that's what it's supposed to look like. You take a sample 4 times a day and then they measure to see exactly where you're at any given time. And there's also something that shows your cortisol DHEA correlation. It'll show if you're adapted to stress, or if you're adapted with DHEA slump, if you're maladapted, phase 1, phase 2. It just shows you a lot. It gives us a lot of great information, because it's important to know which one where you're at, because that gives us a clue of what we need to do and where you're at. And also it shows us this: if somebody's in the very beginning stages of adrenal stress, really you just have to get rid of the thing that's causing the stress, whether it's internal or external, and usually things will be just fine. If you're halfway through the process, sometimes it can take 8, 12, 16 weeks, maybe even 6 months to get those adrenals really healthy again. And if you're already at adrenal exhaustion, it really might take a year or 2 to get those adrenals back healthy and working, but it's worth the effort to do that. Okay. Adrenal medulla under control of sympathetic nervous system. Okay, I just want to make this remark about this. There's 2 sides of your nervous system. There's one side that makes everything relax down. It's what makes your digestion work. It's called the parasympathetic. And there's the other side called the sympathetic, which is that's the stress one. That's the one that's fight or flight. That's the one that makes you run or go or whatever you're going to do. So both of these have to balance out. Now, the adrenal medulla is under the control of the sympathetic nervous system, as you can imagine, because that's your stress pathway. I wanted to explain that because it's going to make some sense here in just a second. Produces norepinephrine, epinephrine, which dilates your eyes, makes them bigger, decreases digestion, impairs your immune system, increases blood sugar. Now, why would all these things happen? Here again, you might be getting chased by a bear. You don't need to be, digesting that sandwich you just ate when a bear is chasing you. You need to get the blood to your, so you can run. You got to have your eyes wide open so you see what's going on. Your mouth goes dry. All these different reactions happen because your body's going through a situation of adapting to that specific. Okay, so what I want to do is take you through the normal adaptation cycle so we can see how the adrenals are working, so we see what we need to do about it. Remember what I told you, that the brain stem, coming right out of here, it will, when there's a stress, internal or external, the brain stem is going to alert the hypothalamus that something's going on. We need to adapt to a stress situation. Does that make sense? We need to raise the blood sugar. We need to dry the mouth. We need to dilate the eyes. We need to suppress the immune system so we don't have reactions that way. You see how it goes. So the brainstem is going to tell the hypothalamus by way of a neurotransmitter called norepinephrine. Once the hypothalamus sees the norepinephrine, it's going to send a message down to the pituitary and say, hey, we need to get some stuff going down here. So then the pituitary is going to send the ACTH down into the adrenals, and then it's going to begin producing the very fast, quick, to dilate the eyes, dry the mouth, get the blood into the muscles. And then the slower long term, increase the blood sugar, squelch down the immune system, that kind of reaction. Okay, and then once you're over that response, enough cortisol and DHA is going to float around the system, and it's going to grab on these receptors, and you know what happens? The process stops. In early chronic stress, here's what happens: you get too much norepinephrine going over here; it's going on too much. The hypothalamus does the same thing it does. Pituitary does the same thing it does. But look what happens. You start producing more cortisol. Now watch this. See the numbers of cortisol you produce right there in normal and DHEAs? See that? And then in early stage, you start doing a lot of that. So what's that going to make you do? It's going to start increasing your blood sugar. This is a person that they don't have diabetes, but this is beginning them on the trail of hypoglycemia and all that because their blood sugar is beginning to raise up. See that? The immune function is starting to go down. This is a person that's like, man, I'm starting to get a few colds, and when I get a cold, I can't hardly get over it. So all these reactions are happening, and not only that, but here's the worst thing that's happening, is that these receptors right here are saying, look, I'm seeing too much cortisol, and I'm seeing too much DHEA, so the receptors start blunting themselves. In other words, you have a tissue cell like this, has a little receptor out here. That receptor says, you know what, I'm seeing too much cortisol, so I'm going to shut that down because I don't want any more. So when it does that, then this feedback mechanism begins to break down because it can't see that there's too much cortisol in the blood because the receptors are being blunted. Does that make sense? Okay. In the early chronic stress response, you're going to have cortisol, epinephrine, norepinephrine are high, and so is the DHEA there. The early stage is what we would call the alarm reaction. Your body's alarmed, and here again, you take the stresses off, get some rest, chill out. Usually your body will be just fine. Most people aren't in that stage. Most people are already past that one. Especially by the time they come see us, because they would have already dealt with it by that time. Okay, in the second stage right here, look what happens. Your cortisol starts going back down, but your DHEA is still high. And look at the receptors. They're really getting blunted, and so they can't see anything. I just want to make this remark. So your cortisol begins to fall, and this causes weak muscles, chronic fatigue, hyperpigmentation. Let me explain this. You know, he talked about the pregnenolone steal, right? So when we're in this stage, hello, pregnenolone steal. That's when it's happening. This is when it really starts kicking in. So what's going on at this point? The body is doing its absolute best to make more and more cortisol, but it's getting worn out. And the cortisol levels are going down, but it keeps on trying to do it, so it can mount a proper stress response. Does that make sense? So what's happening here, oh, by the way, we take statin drugs. And what is one of the side effects of statin drugs? Weak muscles. It's the same thing. It's creating this reaction. And the epinephrine falls. You're low mood, low energy. Personally, I just don't feel good, doc. I just don't feel good. I'm just not doing well. DHEA momentarily rises. This person gets oily skin. They start getting acne. Hair growth. And on women, facial hair growth, hyperimmune function, insulin resistance. This is the lady that goes into polycystic ovarian syndrome. There's the lady right there. Now she has insulin resistance. She's got the hyperimmune function. This is all the stage for this. By the way, I'm going to give you some solutions. Just a couple of minutes. I know everybody's looking at us. Oh my goodness. Don't raise your hand, but can you see yourself in some of these things that we talked about? Yeah. Okay. Serotonin falls. This is where chronic fatigue syndrome, fibromyalgia. Guess what? They released a study a few years back, and they said that if you follow the medical guidelines for fibromyalgia treatment, you can expect in 5 years to have more pain and be more severe and be more widespread if you follow the drug regimen they have. Why is that? Because you didn't find out what's causing the problem. You didn't correct the problem. Oh, doc, I've got this pain right here. Oh, you know what? We got this anti-inflammatory. It's powerful stuff. And for about 3 months, you feel great on it. And then all of a sudden, now you got to have something else and this and that and so on and so forth. Binge eating, low libido, GI problems. Wow, I just have indigestion. I'll take this purple pill. Low self-esteem. Oh, yeah, try this, whatever they're called. Social withdrawal. All these different things. We've got medications for all of these. You see that? Do you see where we've got $1 billion industry going on? We've got medications for all of these that will at least temporarily put a whitewash over this. But guess what? You didn't solve the problem. If you want to live good, live long, and feel good when you live long, you've got to solve these problems. Dopamine rises, you get a regular heartbeat. Doc, what's happening? Oh my goodness, we've got to get you a drug for that. High blood pressure, headaches, anxiety, and nervousness. Anxiety. Oh my goodness, you have anxiety, you have a panic attack. It's all in your head. You need to go see a psychiatrist. You see that? I mean, you see how this is all going? Guess what? It's an adrenal fatigue, late stress response. Now, when we get to late stress, guess what? We're not making cholesterol. We're not making anything. These levels are getting low. Low mood, depression, low libido. Person thinks less of themselves. Same as the mid stage with cortisol. Low mood. You see how all this is going on? You know what? When a lot of people come to this office, they describe to me these symptoms a lot. And I'm always thinking, you know what I'm thinking? Now you know my secret. I'm always thinking, okay, what's behind the curtain? What's causing this? What's driving this? Because if we can figure that out, we can help this person restore their life and restore their health and have a good, healthy, functioning life. And that's what it's all about. Cortisol with low adrenal fatigue, chronic fatigue syndrome, non-refreshing sleep, low libido, lowered immune function, high tendency of getting flu, brain fog, loss of concentration, associated with neck and shoulder pain. A lot of people say, Doc, I just got that shoulder pain. Can you do something? Can you just hit me right there? I got some shoulder pain. And I just have it all the time. And I went to a chiropractor before, and as long as he just bangs down on that, and I do that every 3 or 4 days, I feel pretty good. Okay, that's fine, but still, and I'm an advocate of getting it corrected. Making sure your head's on straight and all that. That's what we do. But I'm saying we have to solve the problem. Okay, I told you there was 3 things before, and these 3 things are not going to take me nearly as long to go through as all that. I had to say all that to get to this point right here. There's 3 main things. I just want to refresh. I'm not going to go through those again. Remember what I said about food sensitivities? It's the number 1 common reason for adrenal fatigue. Number 1 common reason, especially in today's diets with all the GMOs and all the fake foods and all the high fructose corn syrup. Did you see the study that came out this week that shows that high fructose corn syrup, we already know this, causes your brain not to work as well, you can't learn as fast and all this other stuff. But they say if you just take omega-3, you can combat that. Which isn't that the medical approach? My approach would be, well, stop eating the high fructose corn syrup. That's a question. I like the hee-haw thing. They said, Doc, it hurts when I do that. I said, well, quit doing that. This just doesn't make any sense to continue. Okay, anemia, blood sugar. We see all this. Okay, too much inflammation releases cytokines to block adrenal receptors, and please don't shut off on me at this moment. I'm just going to say something real brief about this. This is number 2. The first one was all those general reasons we already know. Number 2 is this one, and that is that, that's okay. That's all right. So the second reason, that's good. See, now that is an example of adrenaline. Did you see that? She got that, boom, that was adrenaline, and we pray that the cycle just stopped at that moment. She's all back to where she needs to be. Okay, good. So too much inflammation releases cytokines. Cytokines is the big deal. Over the next 5-10 years, you're going to hear a lot about cytokines, so I'm going to tell you just a small bit. Cytokines are the things that are released off of the immune cells that drive the immune system to do what it's going to do. Most people have autoimmune problems and all these other conditions. They have a cytokine problem. There's too many cytokines floating around. These are your interleukins, all this other stuff. Now, just forget everything I just said. If you really don't want to know that, that's fine. That's okay. I'm just telling you that because in the years coming, you'll be hearing a lot about cytokines. So, one of the cytokines is called TNF-alpha. TNF-alpha. And what it will do, this is the adrenal, a tissue cell in the adrenals. Okay, this is a tissue cell in the adrenals. This is the blood supply coming through. So, you have a bunch of cytokines running around in the blood. They will leak through, and they will actually get on top of that receptor on the adrenal gland. And so, therefore, the adrenal gland cannot see the ACTH. And so, guess what? It doesn't produce anything. So you can have blockage of your receptors from too much inflammation in your blood. In 2 or 3 months, we're going to do a talk on vascular aging and so on and so forth. We talk a lot about inflammation. I'm going to encourage you to come out to that because we're going to talk about that inflammation. But I just want to put that out right there. If you have too much inflammation in your blood, what would be a reason for inflammation in your blood? Food sensitivities, not enough exercise, eating too much sugar, too many carbohydrates, too much stress. All these things can create inflammation in your body. Infections, gut infections, parasites, blood sugar problems, all these can create inflammation in the body. Too much insulin surging in your body causes inflammation. All these things are inflammation. Head, neck, misalignment. Now this might surprise you. This might actually surprise you. But your position in your head has a lot to do with this process. And why is that? Remember I talked about that little thing called the locus coeruleus in the brainstem? The locus coeruleus is located right here. And what we found is if the head is not in the right position, it can alter the blood flow and even the cerebral spinal fluid flow. And we are suspecting that that is one of the reasons that's tripping off this brainstem portion that's actually doing doing this portion right here, where this is the locus coeruleus, and this is releasing the norepinephrine. And we know this for sure. When somebody's head's off position, we can measure through something called the heart rate variability. We can actually see that the body is going way too much sympathetic. It's going sympathetic dominant. Now that's the reason why I was talking a while ago. There's two sections of the nervous system. There's a parasympathetic that relaxes everything, and there's a sympathetic side that fires everything off. That's where all the stress is dealt with, is on the sympathetic side. Well, as it happens, when somebody has a head-neck misalignment, it can trip off this locus coeruleus in such a way that it causes the body to go too much into sympathetic mode. When it goes into sympathetic mode, guess what it's doing? It's doing this right here. It's tripping off that norepinephrine, which is tripping off this whole reaction and causing adrenal fatigue. That's the reason why some people come in here and they come in with these complaints. We adjust them, get them corrected, and do what we do, and that's all we do, and they do just fine. And sometimes that's not enough. You know, we don't know from one person to the next. We're always willing to try it and see. But if we get your head aligned out and get the pressure off of the brainstem, and we can get that sympathetic balance and get it back into balance where you're not sympathetically driven so much, then that will slow that down. I know I probably went way too far on that, but I really wanted to explain that because it's really important to have your head straight. Okay. Right here's the locus coeruleus. Here's where the brainstem is, the brain, and so that trips all that off. I just wanted to show you that. Think about this. Gravity is the #1 stress on the human frame. Did you know that? Gravity is always pulling us down to the center of the earth. Particularly if your head's misaligned one way or the other, it's going to exert more pressure, and this is going to cause more problems. Guess what? Your head comes off like this. Guess what your body's going to do? Yeah, it's going to compensate in order to keep your head at least over the center of the body the best it can, because that reduces the amount of stress on the brainstem. You reduce the amount of stress on the brainstem, you reduce the amount of this reaction going on here, among other things. Traumas years ago can cause problems today. Birth trauma, car accidents, slips, falls, all these things can cause damage to the spine in such a way that will create a weakness that you will have a long-term head-neck misalignment and never even know it. Might not even have any pain in here and not even realize that could be the problem. This is the miracle case that comes in and we adjust them and they say, Doc, I don't know what happened, but I had this, that, and the other going on, and I was depressed, I didn't feel good, I had achy pain. You just adjusted me one time and I'm perfect. We love that when that happens, by the way. And we'll take it all the time. But that's the case that this was the major problem. Guess what? Behind the curtain we found it. Yeah, it was head-neck misalignment. That can be the third reason. This just shows the blood flow. The blood flow can get disturbed in the brainstem and create these issues. We can measure by heat measurements. Your brainstem sits right up here. Now your brainstem does all these wonderful things. The brainstem controls the function of the body, if you will. It makes the heart beat, the lungs breathe, all these different things you don't have to think about. The unconscious part that makes the body work. But another really cool thing the brainstem does is it regulates your skin temperature. So you should be the same temperature on one side of the body as you are on the other. So if your head's not on straight, I'm not looking at you. If your head is not on straight, what's going to happen is it's going to cause stress on the brainstem, and that's going to cause one side to be warmer than the other. Does that make sense? Isn't that awesome? Because we can actually have a mechanism of knowing when somebody's head's on straight or it's not. The head tail to the right, and the atlas cervical vertebra. These are common things. You see this right here, first vertebra right here? See where that's at? It's supposed to sit right there. Can you see a big difference there? Pretty big difference, isn't it? Yeah. Can you imagine what's happened to that person with their brainstem, what's going on? That definitely could trip that response off. Now this is after, this is before care. It says 7 weeks, this is 7 weeks after we adjusted that person. I don't know how many weeks that was, but you can see the difference. Position of that first vertebra makes a difference. Okay, now we've got to the good part. I said it was going to be 10 minutes, 20 minutes ago, so now we have 3 minutes, so that means you have 6. Okay, I think I may have an adrenal stress problem. What do I do now? This is the part you all been wondering about for the last hour. You're like, okay, tell me, what are we going to do? So here we go. We're going to get to the what are we going to do part. Okay, first step is to find a healthcare practitioner who understands this issue and knows how to successfully walk you through the process. Now, if you're in stage 1 alarm reaction, just find the stresses and get rid of them. But if you're in mid-stage, you're already in that pregnenolone steal, you've got some hormonal things going on, you've got the bloating, you've got this, you've got the tiredness, the fatigue, you're probably far enough along that you really need to be coached through this. And I don't have an ulterior motive for that, because you can go see somewhere else, that's fine, but these issues are really kind of difficult to deal with, and it's not that you're not smart, if you are, but somebody who has experiences working through these issues every day, day in and day out, they're going to have a leg up. If I have a health problem, and I can't resolve it, you know what I'm going to do? I'm going to go find somebody who can resolve it for me. I'm going to find somebody who knows how to get behind that curtain. Because I don't want to just, if I'm having headaches, I'm having tummy aches, I'm having this, that, and I'm tired, my immune system, whatever, I want to know why that's happening. I hope I've gotten that across. So I want to find somebody who can get behind the curtain. So there you go. Okay, identify, and what we will do is we identify causes and establish a baseline to measure success of care. Adrenal salivary index, this is a must. We got to see what's going on. We have to see what's going on with cortisol levels. Adrenal blood profile screen, I'll show what that means in a minute. Food sensitivities, this is a must. Head neck misalignment examination. This, we already saw this, is the adrenal salivary index. This helps us know the ratios between cortisol, DHEA, but also lets us know what's going on. It will help us pinpoint exactly where you're at in the adrenal fatigue stage, and it'll also allow us to know how successful we are with care after we've done it. Okay? Adrenal blood profile, we want to see white blood cells. You know why? We want to see if there's an infection going on. Complete metabolic profile, we want to see how the liver's working, we want to see how the kidneys are working, we want to see how things are working. Hemoglobin A1C, that wasn't spelled correctly, apologize. Hemoglobin A1C, I want to see what your blood sugar's been doing over the last 6 to 8 weeks. Thyroid, we want to look at the TSH, T3, T4. That's not the complete thyroid, but I just want to see a screen to see, are we dealing with thyroid issues? Remember, what's adrenal fatigue's cousin? Hypothyroid. That's exactly right. Is that right? So LDH, this is going to show me about blood sugar. C-reactive protein, homocysteine, uric acid, and sedimentation rate. This is all going to show me about what the inflammation is going on. This one also, complete profile, also shows how the adrenal is functioning. But the most specific to know how the adrenals are functioning is adrenal salivary index. This is what the food sensitivity tests look like. We test 96 foods, and those ones in the reds are the bingos, and you have to deal with that. I tell you, we've seen, I don't know how many I've done. I'm going to ask her. I don't know. We've probably done, Kimberly, you've worked here for 2 years. I've been doing food sensitivities for probably 6, 7, 8 years. I used to say we've done well over 500, but I've been saying that for 3 years. And so we've probably done nearly 1,000, maybe more. I don't know. I don't want to exaggerate that, but we've done a lot of food sensitivities. And my dad said this, passed away this past October, as I was talking about. A lot of stuff that we do is because of what I learned from my dad. I'm very proud of that. I'm very proud of the heritage that we have and the legacy that we're carrying. I'm very proud of that. But he had access to many things. He did nutritional IVs. He did a lot of nutrition. He did all the stuff that we do in here and so on and so forth. He said if I had one test to do on somebody and they didn't tell me what their problem was, they just told me they were sick. If I had one test to do and one test only, he said it'd be a food sensitivity. And he was right about that. Because if you can figure out what that food sensitivity is, a lot of times you can break that whole cycle. Now I'm not disagreeing with doing the adrenal salivary index. You most definitely need to do that if you have the adrenal fatigue. But I'm just talking about in generalities. Food sensitivities, you cannot replace that. It's a wonderful test. Herbal support and adaptogens for adrenals. I'm not going to go through this because I want you to read this at home because we've gone through this. But there are herbs that will help you. But guess what? What I want to do, I want to make sure we find out what's behind the curtain. I don't want to just fill you full of this stuff. Oh, you feel great, because guess what will happen? 3 months later, you'll come back and you say, you know that herb you gave me, it's doing pretty good. It's not working anymore. Guess why? Because we didn't find out what was behind the curtain. Okay, blood sugar nutrition support. I put this up here. There's a lot of things to do this. There's a lot more to do with blood sugar. I don't like to just do nutrition for blood sugar because, exercise is important. Lifestyle is important. All these things are important. Okay, address fundamental underlying causes. Be a patient. That also sounds kind of self-serving, doesn't it? But be a patient. No, I'm telling you, because you know what? I'm a patient too. I am a patient too. I am serious about this stuff. 5 years ago, I nearly lost my life from an autoimmune disorder. It's called sarcoidosis. And I didn't know what I was dealing with when I came down with that. I had no idea. All I knew was I was a healthy, young, vibrant male and just living life, having a great time, doing what I was doing. And when I say having a great time, I have a great time seeing patients. So, it's not a great time. Other people may have having great times, but just loving life. And all of a sudden, just like my feet got knocked out from under me with this autoimmune condition. And I have to tell you, if I hadn't gone to my dad's clinic, which I did while I spent, I was there for probably 6 months. If I hadn't gone there, I probably wouldn't have made it. They were taking care of me every day, and I got adjusted through the process. We did multiple IVs, did so many different things, and that's what saved my life, and I'm very thankful for that. And then for about 2 years after that, I think I was just numb from it, like, what happened to me? You know, like sometimes you get hit in the head and you're just like, what happened? I was like 2 years of what happened. And then, well, it was about 3 years, because my daughter was born 2 years ago. Last Thursday, we had her birthday party this last weekend. But when my daughter was born, I don't know what happened. It just flipped a switch in me. And I said, you know what? I better start figuring this out. Because guess what? It wasn't all the way gone on me. I just had suppressed a lot of symptoms. So I had to go through the process of figuring these things out. So that's what I'm talking to you about this. This is not just something, hey, let's go, let's check your adrenal. I'm talking about we got to take care of health. You have to take care of your health. You have to take responsibility to do that. And you know what? It's worth the effort. It is worth the effort, because if you don't, it will default and something else will happen to you. You don't want to be this person that has heartburn, so they're taking the purple pill. They have irregular heartbeats, so they're taking a pill for that. They have headaches, so they're taking a pill for that. They feel a low mood, so they're taking a pill for that. You don't want to be that person, because it doesn't end up good. You have to find out what's behind the curtain. You've got to find out what's causing the problem. Be a patient. Establishing good adrenal health takes time and effort. It is the key to healthy aging. Did you hear that? If you want to age well, if you want to feel good while you're aging, you have to pay attention to adrenal health. And whatever you have to do to do that, it is worth the effort, I will tell you. Good adrenal health decreases significantly your risk of major catastrophic chronic degenerative diseases such as cancer, heart disease, diabetes. And to me, that's important. That's very important. But probably more important than that is, if you're living, you want to feel good. You want to have zest for life. You want to enjoy life, and life is too short not to be enjoyed. Optimal health requires education, dedication, determination. Good health doesn't just happen. That's absolute truth. First, you have to have education. You say, oh man, I want good health, but if you're not educated, I'll give you an example. If you go out on 55 highway and you're from St. Genevieve, watch it, and you head south, you can hit the gas and go 100 miles an hour, and you are not getting to St. Genevieve because you're going the wrong way. So you have to be educated. And you know what? There's a sea of information out there. All you got to do is click Google and put anything on there, and you'll have 5,000 hits on whatever you want to hit, and it'll say everything you want to. That's the reason why I backed up and I said, when you're dealing with this issue, it's not a self-serving thing for me to say this. When you're dealing with this issue, you have to find somebody. I'm going to bring it back. You need to find somebody who knows how to deal with this and help you walk through it so you can be successful at it. Okay? So, dedication and determination. There's no question about it. And I like this. Never give up. Never. Winston Churchill was one of my dad's favorite people. And he came to Fulton, Missouri, and he got up to do a talk. And I'm sorry if I botched this for the history books. But he got up and he said, never, never, never give up. And that was his life. So, anyway, now actually Fulton, Missouri, he's talking about the Iron Curtain. But hey, it was good. I was rolling good with it. So, he did do a speech. Does anybody know where that speech came from? Do you know where the speech came from? Where he goes, never, never, never give up. And that was the speech, and he was done. Okay, well, on that note, we shall end the program. Okay, I appreciate everybody coming out.